Hello good afternoon everybody สวัสดีตอนบ่ายวันศุกร์ทุกท่านนะคะ My name is Juthasiri Rohit Ratana Safety Specialist from Safety Center for Safety Health and Environment Chulalongkorn University Today I act as moderator for this talk This talk is the first time that Center for Safety Health and Environment of Chulalongkorn University has organized We have collaboration this event with Center of Excellence on Hazardous Substance Management and College of Public Health Science to organize this event. So this is a topic that today we will talk. The topic today is the workplace health and safety in the university, which aim to raise safety awareness and promote safety culture in Thai University. From the registration of GCU system, we have about 40 participants to participate in Zoom and also has the audience from broadcasting allow, I don't know now, but maybe some staff will collect, but I think it's more than 50 or 70 people. The Facebook that you will looking for is from GCU Facebook and College of Public Health Science and also Chulalongkorn University. Okay, right now I would like to introduce you for the speaker today. We have many participants who will speak today. And first, I would like to introduce Professor Dr. Thirayut Vilaiwan. He is the GCU Ajahn and also our boss. He is the professor of chemistry and director of GCU. Next speaker, I would like to introduce Assistant Professor Wattasit Siriwong. Associate Professor Wattasit Siriwong, I'm sorry. He is the Deputy Dean of College of Public Health Science, Chulalongkorn University, and Head of the Center for Risk Analysis and Health Surveillance, or we call CRAS. The third speaker, Dr. Ekala Sombatsawat. He is the first generation of Chula Safety Ambassador who currently postdoctoral researcher in occupational health of College of Public Health, Chulalongkorn University. And the last but big person for the speaker today, Professor Dr. Mark Gregory Robson from School of Environmental and Biological Science and Environmental and Occupational Health Science Institute from Rutgers University. He received an honorary doctoral in public health from Chulalongkorn University. Ajahn Mark is not only collaboration, but he is a part of Chula. Please all welcome speaker. Okay, so the topic we will talk today is about workplace safety and health. So may I start with Ajahn Thirayut first. From your experience as the researcher who teaching laboratory and research laboratory, what is your concern about safety in Thai University ค่ะ
ครับสวัสดีนะครับ Thank you Dr. Juthasiri for the question about my concern about Thai University safety things. Perhaps all of the audience know well, as I know, that Thai University are not really tightly regulated in terms of safety. If you do something wrong, if you do something unsafe, nobody is going to punish you unless something bad happens, right? So you see everything in the university, like in the laboratory, I'm chemist. So I often see people working without proper PPE. I see every waste from the laboratories dumped into the dustbin or down to the drain. We see excessive storage of chemicals. Okay, we see a lot of things, and outside the laboratory is not much better. You see in the office, people use broken equipment, people overload the electricity socket. We have a kind of locked fire door. People do not know where is the assembly point. They do not know the fire drill procedure. They have never been gone for the training. So they don't know what to do at emergency cases. And sometimes the walkway to the fire exit is cluttered with so many things. So this kind of thing is so common. I think everyone in the university are familiar with this thing, okay? And well, nothing happened, right? It is quite difficult. Everyone knows that it is quite difficult for an incident to happen. It requires a lot of series of unfortunate events that it will happen. So this creates kind of false sense of security. People think, well, I have been doing this for all my career. Nothing happened. So why do I have to behave well? Okay, so this creates some kind of misconception. So people take safety for granted. Okay, and among people, I think there are quite different level of understanding. I think from most people that I know, they think that their safety standard or safety practice is already good. University professors always think, oh, I'm the one who know best about my lab, about what I'm doing. Don't teach me, don't tell me what I have to do. I used to be in that position. Okay, but then, you know, it is this is something that when you look at the actual workplace, you see a lot of problems. Okay, professors sometimes they don't even have a look in the lab. They don't even know how their students behave. Okay, and they say they know, but when you look at the laboratory, you see a lot of problems. So there must be some kind of misunderstanding or miscommunication. So these are probably the problems that I, in my opinion, if anyone has something else to add, you're welcome.
How about CCU role for the safety in university and how CCU raise the safety awareness?
Okay, so that's the problem that I mentioned so far is the key points why we need some organization like GCU, and I know that many universities also have trying to set up similar things. Some organization or some body that will standardize and take care of the safety administration system in the university. So our mission at GCU, we try to create a kind of safety administration system by providing standardized guidelines, providing budget, providing people, providing guidelines for making safety plan and guideline to how to kind of implement the plan and do check up, follow up, trying to improve it. Okay, so this is the system that we are trying to implement not only at the university level but also down to the faculty and department level. We provide tools to facilitate the safety management in the university, like chemical and waste management system. We provide environmental checkup program. We provide accident reporting system. Okay, and a lot of other things. Okay, we also provide custom-made training program that is suitable for the risk level of all people involved, ranging from the president to first-year student to even cleaning people. We have all the courses that are custom-made for these people. This is a chance that we will tell them what is correct, what is the standard, what you are expected to do. Okay, and also we are trying to set up a standard that everyone agree upon and practical, and then we are trying to raise the standard of laboratory, office, and including the building to meet that standard. Okay, we do site visit, we collaborate with the safety officer and safety committee at the department or faculty level to realize this, and we even provide some budget to kickstart something, make something happen. Okay? And finally, this is the most important thing, is we try to communicate. We try to engage with our people, our community, to make them see the importance of safety. Okay, we want to make them see safety is something very, very common and integrated into their life. We do it through a lot of channels, ranging from the formal teaching courses and also through informal venues like the safety weeks and something like this. We have a kind of informal talk. Okay, and we also have our channels of communication like Facebook and website, and we also have engaged with other bodies in the university like the PR office, and also we have the so-called safety ambassador. Ajahn Bom is one of the first generation of safety ambassador. So these are selected from students who are eager in helping us to make content and disseminate the content to their colleagues, to their friends. Okay, this is some strategy that we are trying to develop in GCU, and I think other universities may have the same thing, and we can also share and learn what we do. Okay, that's probably all for me.
That is the overall of GCU, what we have done so far. And now I would like to ask Professor Mark about how the Rutgers University has been managed about safety, and also some kind of experience from university from abroad.
Sawadee Krap. Thank you very much. So I think Ajahn outlined very well the challenge at a university. University is a very independent place, and as Ajahn, I feel I know better, and I feel like Ajahn said that we teach people about this, so we must know all about it ourselves, and truly that's not the case. And for many years in university setting, of course, people really didn't push for good regulations. They had guidelines, and guideline is an interesting word. It's a suggestion. I suggest you exercise more. I suggest you reduce your calories. I suggest you do things. But people, it's not mandatory. In the 1990s in the United States Environmental Protection Agency decided that they were going to make laboratory safety and regulation in laboratories their job. The other thing that's interesting is everybody thought we should regulate, but nobody was in charge. So in 1990s, the U.S. Environmental Protection Agency said it's their job. So that's our Ministry of Environment. And with that came regulations, real regulations that you had to follow. And people read them and kind of paid a little bit of attention. And then the audits came, and they came and audited the universities. And several very big universities had audits, and the EPA wanted to make an example, prove a point. And so they had in the newspaper, such and such university fined $10 million for violating health and safety. And that got people's attention. So at Rutgers, our director of health and safety took this very seriously, and we had launched a program to inform. Think about all the people at a university. At Rutgers, we have 71,000 students, undergraduates, graduate students. We have 24,000 faculty and staff. That's almost 100,000 people. That's bigger than many cities. And we weren't being careful with this. And I think the most interesting thing was the first meeting I went to on this topic, because I was executive director of our Health Science Institute. I sat next to the dean of the art school. And she said, "What do you think of this?" I said, "Well, you know, it's going to be a lot of work, and we're going to have to pay more attention and enforce these rules." She said, "Yeah, but think about it. You are laboratory scientists. You understand this. The art laboratory has the same chemicals, solvents and paints and poor ventilation and not proper storage, and many of these things are flammable. So all of a sudden, the entire university became part of a safety program, not just place you'd expect, a chemistry laboratory, a microbiology BSL-3 laboratory where people know to be careful, medical school laboratory where lots of contagions. But now, art studio, athletic building, the maintenance facility who keeps all the cleaning materials for the floors and the walls, that became part of university safety. But to make this work, people had to be very strong. Our vice president at the university, it's interesting, he is economist by training at the time. He said, "There is zero tolerance. If you do not comply, I will close down your lab, I will remove your funding, I will fire your staff." And the university was very strong in 1990s, and I'm proud of them that they did that. It was a lot of work to comply, but I was proud of them that they did that. And the reason they did it is already other big universities, you know, Rutgers is 8th oldest university in the United States, okay, started in 1766. And so lots of name recognition. We did not want our name in the paper for something horrible. We wanted our name in the paper for, you know, good science and winning football team. Not for violation. So I think that was what happened in the United States. And what happened across the country is that people started to take it seriously. As John said, we don't want to have an incident. What really motivates safety in a laboratory is when something bad happens. A student gets sick, or more unfortunate, a student dies in accident, or staff, but mostly they worry about student. That prompts everything to become very reactive, and then it's too late. You know, prevention is the key in good health and safety. Think about the people that work at a university. As John mentioned, you have first-year students. Okay, they are 18. They're kids. They're excited. They're going to college. They want to learn. They want to go to medical school. They want to go graduate school. And they're in the laboratory, but they have on their earbuds, and they're listening to their mobile phone, and they don't want to wear the mask. They don't want to wear safety goggles. And this is a tragedy. And so that's where this trend was. It started in 1990s, and I think now it's become very, very much part of the culture. And it can't be an afterthought. You know, you can't say after an accident, "Oh, you know, we should have had training for safety." Training for safety happens first. And, you know, the government even says for grants from many agencies, including the grants we have with Thai universities. We have projects here with Chula and also a project with Mahidol. And we have to put in the application for the grant that we will train everyone who participates, including faculty, not just the student, you know, because students have to do what Ajahn tell them to do, but you have to train Ajahn, which means that the president of the university, the vice president for research, the deans have to embrace this, not just say, okay, we do this. They have to be strong and make it happen. That's what's in US, and I'm happy to see that's what here at Chula.
Okay, thank you for the first round, Ajahn Mark. So we come back to Chula and for Thailand. So Ajahn Wattasit, as colleague of public health science, is the user of safety policy of Chulalongkorn. What is your plan and what is your experience according to user role?
Thank you very much. First of all, thank you for the directors and respect Professor Mark Robson that come to join with us today. Because of this is one of the mission of the universities that we concern very much about the safety. Actually, not just only for the student, but cover for the staff and for our who work with our university. And this is very good, very, very good thing that we share of the knowledge. I mean, because this is maybe the first thing that we run the program in the universities. And in the past, as I teach about the occupational health, and Ajahn Mark be our visiting professors, we talk a lot about the safety with other jobs, but people mostly think about that become professors is very safe, no risk. But actually, from my side, we are risk, not only from laboratory, with workplace, with stress that we facing, especially during the COVID time. This is the thing that every occupations facing with the risk of something has us allow us. So this is very good news. The last thing today, this is 5 years of the center, right, Ajahn? And now time to share, we say communications. We communicate about the risk, the shares of how we success, how we conduct the centers and let every members, faculties do as the good thing that we do, the wording of the standard more meaningful, not just the wording standard that we do by regulations. At the college, we try to train, try to give the information to the student and our staff to follow, not just to follow, but follow with, literate, know why you need to do, right? And for example, we use a mask during we do laboratory. Today we don't use masks because by regulations we feel safe. One, how we trust we safe, we know allow us we safe. That's how we learn about this because of not just only give the knowledge, but by practical too. And as I teach more than 15 years, and we have the program on occupational health, the college thinking about the new educationals in the future, like ITAM, like we have the workplace for industrial or even general office in Bangkok, that we need the safety. We concerned about the staff who work with us. Our secretary next door, who do the copy machine, copy many things for us for sign that expose many chemicals. We are going to have the new building and move up very soon and furnish with the new brands of walls, but that is contained with the solvent, right? The chemicals, and we expose it 20, maybe 8 hours a day. This is may risk for the people, so how we can save them, and together with laboratories. For me, when we teach the student, we teach not just only the grant that we have to write down about the standards of the laboratory, but we need to know more. For example, how to save for others. That means responsibilities. Responsibility for not just only the student themselves, but their friends. And also the release from the lab, something released from the lab is toxic. How about the management? It's lucky that the university had a system to collect the waste and send to the third party for cleanup, for reduce the hazards, something before release to the environment. This is a good program because we think that the next generations would be good we think about sustainability ครับ when we train like this นะครับพอ the new program we join with the center to train like the first year of the student because at the college we teach for the graduate levels so we put the safety at the beginning of the course of public health science that we have something like this I think safety can be integrated for every faculty in Jura and also outside we have the same นะฮะ outside we have other faculty the same characteristic we do but this is I think it is the responsibility to the socials ครับ so and the other thing when the student want to come to learn with us they would like to ask how about your laboratory if we have no lab that have a good standard some people not like to come to join with our laboratory even we have the collaborate with the international university they require of this ครับ so that's why this is it's important and necessary for not just only for the university but for the college too who be the users of this program ครับ
ค่ะ thank you ค่ะอาจารย์วัฒสิทธิ์ and next I will move to student experience อาจารย์บอม could you please briefly explain about your experience when you were student and also Jula Safety Ambassador and like now you are currently a fellowship for the postdoctoral fellow please give some experience and your plan and what you want to see
Yes, thank you, GCU, to having me today again. So I am working with GCU since 2019, and as a Jula Safety Ambassador, we at that time we did a lot of campaigns and activities to promote about health, environment, and safety in Chulalongkorn. For example, we did an event to provide N95 masks to the Jura staff, students, and the people around here to protect themselves from particulate matters like PM 2.5 or PM 10. And we also did video clips to like give health education, and we did training course as well, especially in ergonomics. That I am a speaker in this course as well. So when we're talking about like ergonomics, somebody like, oh, what does it mean? Yeah, it's kind of weird word, but ergonomic is the science of the fitting the job or equipment to the human. And I will give an example for this era. The people use a lot of computers, tablets, smartphones, right? For like work, study, even in entertainment. Many people like use it many hours per day with like awkward posture, like head forward, shoulder up, and inappropriate table workstation or like a bad environment. So, and this is called effect to the human body, like neck pain, shoulder pain, back pain, something like that. Even we try to like sitting and having like a good posture, but the really important thing, the equipment is really not support us. That's why we have like a bad posture. That's why ergonomic is really important in the university, because we have like student like graduate and undergraduate student, they like study online like 8 hours, and especially in professor as well, sitting on the computer a really long time. Yes, and I went to like the office worker and many factory, I found interesting information that the office worker have had higher prevalence of muscle pain than the worker who working in the line production, because the office worker, they like only sit like the fixed posture for like many hours. On the other hand, the people who working in the line production, they like move the body many times, every time. That's why this problem is really concerned in the university. So, and I have been working with the Ergonomic Society of Thailand like for almost 9 years, and I apply many knowledge to share in the university, to the class, to the TCU as well. Because I am working with many academic person that specialize in ergonomics, that came from the university in Thailand, and some of them like develop the standard, the ergonomic standard as well. And for example, the ergonomic standard for office worker, and I think Chulalongkorn and many universities in Thailand need like adapt this standard, how to choose the ergonomics table, how to adjust the chair, and how to like work like a good posture. And I think this is made like good for the student, for the staff in the university. And moreover, I would say that I have chance from TCU as well to talk like in the training course. And Ministry of Labor invite me to be a committee to revise the ergonomic regulation in Thailand. Because in Thailand, we have just only one ergonomic regulation, and published in 20 years ago. And they try to like update, revise, and add some important thing like the method, how to do an ergonomic risk assessment that provide to the worker and the people in Thailand. Yes, and I think peace waiting for this regulation published, and I think it would be a benefit to university and Thai people.
Right, because as the TCU, we have planned for next year that we will establish the office safety standard, and one part of standard manual gonna be ergonomic standard that will apply for Jula worker and also for student. Okay. For next question, I would like to ask about the expectation. Ajahn Thirayut, what do you expected for next 5 years for Thai university safety in terms of safety?
Yes, our vision, well, I mean, the university vision, Chulalongkorn University want to be a role model in safety administration system in a sustainable way. We want to see our people working in safe environment. We want our people to be safe. We want the workplace to meet this standard. And ultimately, we want a safety culture to be in DNA of our people. Okay, by safety culture, in my opinion, I think it is whenever all people do not tolerate compromise in safety, that's when safety culture already exists. I think it's not yet happened here in Thailand, not yet in Chula, not yet in many places. When you go to laboratories in the United States, in the UK, the first thing when you enter the laboratory, you have to pick up your glasses, safety glasses, and before you can enter the lab. And everyone do it automatically. If you don't do it, you are kind of weird people, you are a bad guy. It's like before yesterday, everyone have to wear masks. Okay, if you don't wear, you're a bad guy. Thai people, surprisingly for me, Thai people seem to be very well behaved in this aspect. They see the importance of preventing themselves from getting infected. I want this thing to happen in terms of safety in the workplace. If everybody automatically put on their PPE when they enter some risky area, or not only protecting yourself, but if you see somebody else do not conform this, you don't tolerate them. You ask them to do it immediately, otherwise get out. We want this thing to happen. I know it will be a long way to go. John Matthews said, we already success. No, we are not yet. It's still a long way to go, but at least we are starting. We are starting, and I'm happy to learn that other universities also starting. Okay, and safety will happen only if we have sufficient momentum. It's kind of social practice. Everyone need to see the same thing, needs to share the same philosophy, and until that point, okay, that will I will say safety culture is happening. So it's a task of everyone to share, everyone to help. It's not the policymaker, it's not the administrator, it's not the task of GCU or the safety officer alone to make this happen. Everyone needs to give their hands. That's my take-home message.
Thank you, Ajahn. And next, what about Ajahn Wattasit? What is your expectation for safety in research?
For me, I think myself is that sustainability. I mean, for the universities, we success in terms of starting, become the pioneer is really tough sometimes to change, because at the college we try to have like interventions, change the behaviors is very difficult for the people. Like we do the research in farm, we train the farmer to use the mask to have a good practice, but it's difficult to do that. Need the time. Now 5 years, I think good start, good motivations. All the staff of Chulalongkorn and our faculties in the university realize that we have the program of safeties, and not just only useful for laboratory, but for the officer too. My staff also really happy that we have the program and join the program because of one. You may know that we are going to have the new building. When we have the new building, everyone wow with the new furniture, but the furniture some company not made from us, like Dr. Baum do. He changed, revised the standard. The standard 20 years ago may come from abroad from outside the country, maybe come from a Denmark country, like other standard that now we rely many standard. But this is good for Thai learning. University teach people and people learning, right? As the professor, we learning by experience from the center, lifelong learning. Learning, and we open mind, not just only know the wording safety in the futures. I think that this is the wording of the culture, is your slogans of the center. The culture become the culture. Everyone feel free to do, like to use mask when they feel this is risk or facing with hazards. This is thing that we want to see is sustainability on safety levels, not just only Chulalongkorn, but for other universities too. I think we learn and maybe good thing from outside, like from Professor Mark too.
Can I just add a little? It's not only the faculty learn from GCU. Actually, GCU learn a lot from our user, from our faculty, and we try to kind of working in two ways. Communications. It's not us staying on the ivory tower and try to set up some rigid rules and ask people to follow. Okay, we want to see the rule is practical, but doesn't compromise the standard. Okay, so we learn from each other, I would say.
And how about Dr. Ekarat? You mentioned a lot about ergonomic. And what is your expectation for ergonomic in university or even in other workplace?
Yes, for my expectation about the ergonomics in university and workplace, so I would say that I hope ergonomic is like go in everywhere in the university. It's not just only the lecturer, the center in Chulalongkorn, but we can put the information like the GCU did now, like provide the information by Chula Safety Ambassador to the student. Because student is really important thing that I hope they understand about the ergonomics, because they study like 8 hours per day with like electricity, we are like, I would say like we're lucky that we have GCU to like look after about the health, safety, and environment. But I don't think this is a duty of the GCU only. I think it is everyone's duty. We have to help each other learn the new thing together and improve health, safety, and environment in Chulalongkorn, like sustainable. Yes.
That is all speaker expectation. And I will back to Ajahn Marx. And could you please tell us how to achieve all this expectation in terms of safety and sustainability in university workplace?
So that is a very big question, but I will try. And I think the most important part of this is how you achieve it is ownership. Safety starts with you, okay? When you look in the mirror, you are the person that is most responsible, certainly for your own health and safety, because you make choices, but for the health and safety of everybody else. And it starts with every single person at Chula and every person that they touch. And you know, at university, as Ajahn mentioned, we're teachers, okay? And sometimes we're not best student. We are a very good teacher, but not the best student. We need to be a good student too. And so every single thing we do is a teachable moment. I love that term because I believe that term. Okay, it's a teachable moment. COVID-19 taught us many things. Think about it. For those of us that do occupational health and safety, we all know about N95 mask, and we talk about respirable particle. But now all of a sudden, the person on the Thai news, I can only listen to the English Thai news because my Thai nitnoi. But you listen to the news, and now the newsman and the newswoman, they talk about respirable particle and PPE. They didn't know how to spell PPE before. Now they know this. Okay, people on the BTS have space between themselves. So here at the university, we need to be the people who set the example. And I applaud in the most sincere way Chula, because they're trying to be like our slogan. You know, I am proud Chula graduate too. I have honorable degree from Chula. So I am also proud Chula graduate and pillar of the kingdom. And so, it's important because Chula needs to set the example for other people to see. Industrial partner, if they give grant to us at the university and we don't follow the rules, they don't take us seriously. One of the most interesting things I experienced many years ago as a young faculty, I went to a meeting at DuPont Chemical. At DuPont Chemical, their original product was gunpowder. 150 years ago, they started a policy that before every single meeting, even meeting with just breakfast to talk about, research idea, they have safety and they have little drill. Because when you work in a gunpowder factory, you need to know where is the exit, and you cannot look for it, you need to know. And so, why am I telling you this story? Because it made a culture of safety, and everybody at DuPont, worldwide, all over the globe, they think safety first, because every single meeting, it is mandatory. And so that's part of the culture. That's part of the culture here. And the other thing is, if you are the vice president for finance, you know, you look and you say, well, what does this have to do with me? It has everything to do with them too, because when you have sustainable practice, you use safer chemicals. You have less chemical waste, which saves money. You have less accidents, which saves money. You have students who feel safer and more connected. That improves the learning. So the entire process works if everybody buys in. And I have to tell you, I sit here very proud, you know, as Ajahn Chula, because Bo and Bom and even Ajahn Po are my former students. I am co-advisor to all three of them. So I sit here and say, the future of Chula is here for safety in this room. And I am the academic grandfather to the future of safety at Chula. So if this works really well, you can put my name on building and say, this is why. If it doesn't work well, you can forget who I am. But I think that this is a first start, to have safety talks like this, to remind people every day. Safety isn't when the accident happens. The video that the unit put together is very good video, and they say many times it's a drill. Why do we have a drill? So we know what to do for the real thing. But if everything goes right, you never have the real thing. You know, think of yourself like someone going on airplane, okay? On Monday, I will fly back home to the US. Before the plane leaves, in Thai and in English, they will tell you about, you know, how to evacuate the plane, what happens if the mask comes down, what to do if there's a problem. Airline industry has had to be safe every day for very good reason. Now we have to pretend that we are all flight attendant and know where the exit is, and know how to put on the mask, to know how to be safe in a laboratory. Think about how laboratories have changed. I am the oldest one sitting up here today. So, you know, when laboratory instrumentation was chart paper, and, you know, you had to work hard in the lab, but we had very poor training as a graduate student. Now everything is very sophisticated, but the risk isn't any less. Now we use nanoparticles, okay? Now we deliver things, and we measure things in parts per billion and trillion. So the sophistication laboratory is exceptional, but the risk is still there. So for me, I think I am optimistic that we'll do it right. We have new opportunities. We have training like this. People can get an app and look and see how safe or how dangerous something is and help them make a decision, okay? Google has become a big tool for everything we do, but that's okay, as long as Chula is the one who puts up the app so we know it's safe. So I think we're in good shape. I think going forward we have good opportunity. But let's remember that teachable moment means that you cooperate with the faculty first. Invite the faculty for training and have everybody feel involved, as opposed to go after the faculty and scold them or shut them down because they make a mistake. And I think that breeds the culture, that builds a culture where everybody feels that he or she has investment. Thank you, Kap.
Thank you for our speaker. Now, I think there has some kind of question. From Facebook, you can leave comment or question via the chat box, and also Zoom, you may leave some question. Okay. If it's not, may I ask about question? Because like safety literacy, it means like people who has knowledge about how to do safety work, safety learning, safety work, but they know, but actually they not do the right thing. I think this is a challenge. Like, I mean, it's important because like in Chula, we have many lecturers, many high-ranking lecturers, many high-ranking officers. When we have like executive safety course before, they said they have no time to learn it, and some said they know or they know, but actually they don't do it properly. So it's very hard to induce these people to learn the cost. Even CCU try to adjust the cost for executive safety cost for Jula executive staff. There's some kind of stuff that they voluntarily to learn it. It's okay. It's just only 10 or 12 hours. It's just very short course, but still has some no idea. I raised this problem because I think to raise the awareness to be the safety culture, it should have kind of executive people who has high ranking in that office do it like the role model first, or do it together. So it's just my comment first, my point of view. But my question is, are there any kind of the solution to help this kind of people who has high knowledge, high ranking, and learn or doing properly thing?
So the important phrase I learned years ago is the humility to learn. And you have to be humble. And when you become senior person, it's harder to be humble. Graduate student is humble. They have no choice. But when you become, senior person, it's harder. I think for us in the U.S., it's become very clear. I just, in fact, it expire on the 19th, so I took the 4-hour refresher for health and safety online. Because last time it was, I actually did it last time here in Thailand when I was here. I did not meet the deadline, and then they just froze everything, and then it took me 19 hours, so I learned the hard way for 4-hour refresher. With things online, with computer-based assisted, there is no excuse. Everybody says they're busy, but they still can manage to watch Netflix. They can still sit there on Facebook. So guess what? You can still do this. I think that, in the United States, we use the expression stick and carrot. So carrot, you dangle in front of the animal, and the carrot is the incentive. The stick is you hit them over the head and make them do it. Sometimes in academic setting, you need to have big stick. And you just have to have it. It's not optional. If there's an accident or an explosion or someone dies or long-term there is a cancer cluster because, when I think about how we use chemicals, remember Ajahn started college in 1973, 50 years ago. There was very little training in safety, and especially with even microbial contaminant. Now we learn about all this stuff. And I'm sure there are many people who had exposure. We teach in risk assessment about latency period, You get exposed when you are 20, and when you're 70, then the cancer manifests itself or the health neurological problem. So we have to reinforce to early users, student, this is a risk. And then hope that people stay safe. But that means that you make it easy for them, but you still don't let them get away with it. You have computer-based learning. You can sit there at night in your house in front of your laptop with a can of soda and listen to music and have pizza or something, but you still have to do it. And if you don't do it, the university has to say no and shut down the lab. And that's what the government has done in the US, and that's what my university has done, is they deny your privilege to have access to equipment. And then people go, well, I can't do my work. If I can't do this, you go, well, then you have to take the safety test. You have to demonstrate this is safe, and you have to show your students. What does a student think if the professor does not wear a respirator? I think the most amazing thing is I visited our medical campus the other day, and as I walk in, I see 2 physicians I recognize, and they're standing outside on the corner, outside the building, 25 feet away, because require, smoking a cigarette. Does that make me feel good? That physician, and then you walk in, what does it say? No smoking. Smoking is bad for your health. 2 senior faculty are smoking. And we learned from COVID, what is one of the largest risk factors for really getting bad COVID? Smoking. So, it all makes sense if you pay attention.
Okay, Fortunately, CCU doesn't have the authority to shut down the lab yet.
I'll show you how, Ajahn. I teach you.
Thank you. We have to learn from you.
Okay, it seems like no more questions from the audience. Then I would like to thank you all our speakers again for this fruitful talk. And for the great talk today, it was a pleasure to have you with us today. So to conclude this talk, thanks for all attending. We hope you learn and enjoy the safety talk, and don't forget to rate us by evaluation form. See you in next talk. สวัสดีค่ะ Thank you ค่ะ